The prevalence of autism in Africa is similar to other regions, but access to diagnosis and treatment is limited due to challenges such as a shortage of specialized healthcare professionals and resources. Africa 54's Paul Ndiho is here with a special guest. Hello, Paul.
Hello, Esther. Thanks. DECODER Health, a non-governmental organization based here in Washington, advocates for children with autism spectrum disorder in the US and Tanzania. Lasway, the founder and chief executive officer of DECODER Health, is here. Is at the forefront of debunking stigmas and raising awareness about autism globally, with specific focus on supporting people with ASD in Tanzania. Hello, Anne.
Hello, Paul.
Welcome to the show.
Thank you so much for having me.
Let's start in Tanzania. You've been doing a lot of work in this area of autism. What does it take to do that?
Oh, absolutely. Well, the challenges are astronomical. I mean, it ranges from stigmas to lack of infrastructure and capacity in order to treat children with autism. So my organization is specifically geared towards tackling those challenges.
How about on a continental level? This is something that goes beyond Tanzania, goes beyond the United States. You've been instrumental in doing some of this work across the region. What can you tell our audience about the issues people deal with when it comes to autism?
Oh, absolutely. So autism is a global health issue. We're seeing increased prevalence over the past several decades. For example, the Centers of Disease Control and Prevention here in the United States have stated that 1 in every 36 children are born with autism. The World Health Organization have quoted that 1 in every 159 children are born with autism in Africa. And of course, the prevalence, the exact numbers are unknown, right? There's lack of data, or it's limited, but it is definitely a huge issue. And we're looking at specifically providing the therapy, the care, and also addressing some of those stigmas, which are a really large challenge for this population.
I have a cousin sister who was a kid who is autistic, but we didn't know until maybe later on in life. How big is that issue of stigma when it comes to dealing with this, especially in Africa?
Oh, it's a huge issue, and it really compounds the problem, because on top of dealing with understanding what autism is and providing care and therapy, parents also have to deal with the community and addressing those stigmas and everything that comes along with that. So it really further compounds the problem. Some of the stigmas are, especially in Africa, could be related to witchcraft. It could be related to curse, like people may say you have generational curse. And then sometimes it could be something as bad parenting. They may say, well, a child is behaving a certain way due to bad parenting, or they're being disrespectful. But in actual reality, it's a natural neurodevelopmental disorder caused by autism.
How about here in the United States? You also do some work here.
Yeah, absolutely. So I'm a founder and CEO of an organization called DECODER Health. And in the United States, we provide what we call ABA therapy, which stands for Applied Behavior Analysis therapy for patients with autism. And we're looking at advancing that similar care and model to Tanzania.
Let's talk a little bit about how you get funded. How much of your own resources do you put into this to make sure that at least the people that you're trying to serve back in Tanzania get some help?
Well, right now it is self-funded. We are looking for additional funding from sources with similar mission. I do have a partner for the IT aspect. They're called Tiba Salama Digital Health App, and we're all coming together towards this great mission and working with other collaborators such as LITAFO, which stands for Living Together Autistic Foundation. We all just come together to try to address this challenge, but it is self-funded.
When you've run into people who have autistic children, what are their stories? What do they share with you, and how can they get help?
Yeah, no, absolutely. First and foremost, it starts off with acceptance. They tend to want to understand and accept that their child has autism. And at the same time, they want to learn more. How can they help them? Sometimes it comes together with having some denial, and that is okay. But with education and the right support and infrastructure, they get the help they need.
Very briefly, how can people reach out to you if they wanted to help, or how can you help those people who are looking for help?
Oh, absolutely. Thank you for asking that question. So we do have a website, www.decoderhealth.com, and we also have Instagram handles. If you look up DECODER Health, you should be able to find us there. We are looking for partners to come together towards this great mission because the need is there, the challenge is there, and I think together we can definitely help to make a difference in Tanzania and just overall around the world.
Well, Anne, unfortunately, we've run out of time. Would love to have you back very soon.
Thank you so much. Thank you, Paul.
And Lasway is the founder and chief executive officer of DECODER Health. Back to you, Esther.
Thanks, Paul, for that very informative discussion.